Kwekwaja Mameno has defended his decision. By the way, his Minister for Health not to seek parliamentary approval for a COVID vaccine contract with Sheikh Al Maktoum in breach of the Constitution, saying it's because Ghanaians were dying. He says he was desperate to get vaccines and was frustrated because regular vaccine supply sources had failed. He's been responding to questions at the sitting of the parliamentary committee probing the contract.
Did you seek parliamentary approval before you entered into this contract?
No, please.
You did not.
Have you any such plans?
I thought she was going to have a follow-up question. I had plans to come to regularize the parliamentary approval, to seek for parliamentary approval after I've signed the contract.
Do you appreciate the fact that the pronouncement by the Supreme Court vis-a-vis the constitutional provision clearly talks about prior approval? You appreciate that?
Honourable Chair, very much so. But my frustrations to try to get a vaccine for us at the heat of our second wave, I relied on the Executive Instrument 61 that was passed by Parliament to hide behind emergency clauses that have been invoked, to try to see if I could do that and come to Parliament to inform Parliament that this is what I've done and therefore need regularization. I need approval to cover it because we were in dire need of the vaccines, and I had the onus to try to procure the vaccines to vaccinate Ghanaians to protect our lives.
But the EI is subsidiary legislation.
Honourable Chair, I must be very honest with you. At the time, I've mentioned my frustration was the fact that I seriously made that error, and on hindsight, it won't happen any longer.
Mr. Minister, you are a senior member of this House, and you are aware of how we deal with emergency situations in Parliament. We have conventions and rules and regulations governing how you deal with emergency issues, i.e. appearing before the relevant committee and make a case so that the issue can be dealt with as an emergency issue. Why didn't you take advantage of that procedure?
Honourable Chair, I've explained that those were not normal times, and I was seriously in the situation that couldn't make me think properly, the way you think that now I will actually address myself to the situation.
Mr. Minister, are you aware that we have dealt with issues and motions on the same day before on the floor of the House, in this House? And let me give you examples. You remember the 1.2 billion and the $100 million from the World Bank? We dealt with it the same day. Couldn't you have done that?
I could have done that, but the circumstances at the time was a little bit different.
Honourable Minister, you have laid evidence before this committee that you used your best efforts to get diplomatic channels to enable you reach the manufacturer or the Russian authority directly. Is that correct?
Yes.
You even did so by producing letters as evidence of such correspondence. Is that correct?
That's correct.
You further indicated that it was after all those best endeavors have proved futile before you dealt with the Sheikh. Is that correct?
That might not be correct. I dealt with the Sheikh before the frantic efforts to try to get the vaccines from the right source.
So, were you being untruthful to this committee when you indicated that you used your best efforts to get direct access to the manufacturer and the Russian authorities before you dealt with the Sheikh?
I can't remember I have said this anyway. What I said was that I made efforts, but I didn't just oppose the timing of the efforts that I made.
Minister for Health Kwajima Menu says Ghana will pay Sheikh Maktoum for 20,000 doses of Sputnik V vaccines delivered to the country. This is despite his inability to deliver all 3.2 million doses of vaccines requested for in a contract with the government of Ghana, which he has since terminated. Parliamentary correspondent Joseph Opoku Gakpo joins me live from Parliament. Gakpo, let's begin with the reaction. He says the 20,000 doses delivered earlier. And what else can you tell us about what the minister has been saying?
So there were specific questions to him on how much government is likely to pay as far as this particular contract is concerned. And he explained that despite the initial contract, they requested that Sheikh Maktoum brings in some doses as evidence that they will be able to deliver on the contract. Initially, he brought in 15,000 doses when it comes to the first dose, because then the first dose of the said vaccine is different from the second dose. The first batch that came in was actually 10,000 of the first dose and 5,000 of the second dose. So then government requested that he brings in the extra 5,000 of the second dose, so that then there are 10,000 of the first dose and another 10,000 of the second dose. Mr. Menu has been explaining that that initial 20,000 doses that were brought in is been administered to key public sector officials, including those who stepped out recently to do the census and other frontline healthcare officials, because then they needed to be vaccinated one way or the other before they step out on some of those very critical assignments. And so that was done. Although the terms of the contract had been breached, those 20,000 doses that were brought in have actually been administered. Ghana has made use of them. And so after the Sheikh indicated on the 14th of July that the contract has to be terminated, and went ahead to write to government and indicate that it has terminated the contract, well, a conversation will subsequently begin on how much they may have to be paid for the first 20,000 doses. And then government may then go ahead and fulfill those obligations. But he makes the point that that is still a conversation that's outstanding, that's not gone ahead yet. So they're waiting for those times to come for the negotiations to be done. But he confirmed that although the contract didn't have parliamentary approval, although the Sheikh did not meet the terms of the contract by supplying all the 3 million doses plus, they will still have to be paid for the 20,000 doses that have been delivered earlier.
What has been the reaction from the minority?
All they've done is actually ask questions, as they insist that this particular conversation has all been about. It's just been a probing section as far as the MPs on the minority side are concerned. Kwabena Mintakando, who is the ranking member on the committee, kept going back and forth with the minister, seeking clarity on what exactly government's position is as far as the termination of the contract is concerned. Not just that, Elizabeth Ofuswajare, another minority MP on the committee, has also been raising questions about government's obligations and what all of this will mean. And she has placed a lot of focus on the role of the Attorney General in all of this, because then what happened was that the Attorney General actually communicated to the Minister of Health in a letter indicating that there is the need to seek the necessary parliamentary approval for this particular contract. But the minister explains that it got to a point when he was very much clear in his mind that this contract was not going anywhere because the Sheikh in question had repeatedly failed to meet the obligations of the contract. And so he didn't find it necessary to go ahead and seek parliamentary approval for a contract that the Sheikh would not be able to deliver on eventually, which was how come he hadn't gone ahead and brought the document to Parliament for the necessary approval. But initially, because he was frustrated, because Ghanaians were dying from COVID-19, and because he was desperate to bring in vaccines for the populace, that's how come he went ahead with the contract without the necessary parliamentary approval. But subsequently, he was hoping to regularize the contract, but things, it eventually became not necessary because then the contract in question had been cancelled. And so the minority MPs are obviously not happy with the payments that may have to be done to the Sheikh in question, but they're hoping to put out all of those details when eventually they publish the reports of the committee on this particular investigation. Aisha.
Funds for vaccines? Did the minister...
I missed that.
Yeah.
If you could repeat your question again.
I'm asking about alternative plans for vaccines, if the minister hinted on that.
He spoke about that on Thursday when he first appeared before the committee and indicated that there is work that's ongoing with the COVAX facility to bring in some vaccines into the country. He made the point that as early next month or late next month, about 1.2 million doses of the Johnson & Johnson vaccines are expected in the country from the American government, again through the COVAX facility. He again explained that even beyond the donations that are expected, work is ongoing to ensure that government actually buys some of the vaccine doses separately from some of these manufacturers. So he says, despite the development in question with the termination of the contract with regards to the Sputnik vaccines, efforts are ongoing and expectations are high that some vaccines will come in through the COVAX facility.
So what's next for this probe? Is it over now? And when do we expect the committee to present a report to the House?
Well, it's not over yet. The health minister is expected back before the committee on Wednesday because there are a number of other outstanding issues, including claims that he allegedly deceived the House about the prices of the Duxin, which is like the 7th item that the committee is probing. They've not got into those specific details yet. Earlier today, a number of other officials, apart from the health minister himself, did testify before the committee today. We had, among others, the head of legal services at the Ministry of Health appearing before the committee, Umwa Yusuf. He's the director of legal services at the health ministry. Not just him, Tete Kofi Romeo, who is director of supply chain at the health ministry, also appeared before the committee and was sworn in to respond to some questions. And Komla Bedu Afare, who is chief director at the ministry, also appeared before the committee to respond to questions. There were a number of other disclosures, including a disclosure that not even cabinet approved this particular contract before government went ahead and signed this particular contract. And it's one of the things that the minority MPs said that they were not very much excited about. We're expecting that Wednesday there will be further questions on that to the health minister. And additionally, there was a disclosure from the health minister that when you look at the $19 price for the Sputnik vaccines, as far as the contract with Sheikh Maktoum is concerned, it actually included other provisions, including transportation, as well as issues having to do with storage and injections that will be used in getting out these vaccines. So then he made the point that he was very much aware that the ex-factory price is actually $10.5, but all these other incidentals fed into the decision to agree on the $19 price. And so all these are other aspects, as well as interrogation of other officials apart from the health minister. That's expected on Wednesday when the committee resumes sitting. And the committee has up until next week, Friday, to actually deliver its report. We wait to see whether by then they will be ready with their report, or they may request for a possible extension of their work so that then they would have more time to actually probe this particular issue. But the expectation is that most likely sometime this week they would go ahead and complete the public hearings, and then they would go ahead and write their report sometime next week and submit the report to the plenary of Parliament before the House takes its break, which is expected sometime in the first week of August.
Joseph Opoku Gakpo, he's our man in Parliament. He brings us updates of all the happenings in that House.